In this report, I will be describing and explaining the physiological and psychological responses to sports injury. I will then be looking at two examples of athletes who have experienced injury and how it affected them. As soon as an injury happens, there are some physiological responses, which is the body's way of trying to protect itself. The very first response to an injury is inflammation. The reason our body makes the injured area inflamed is to protect it against harmful substances, get rid of dead tissue, and help the growth of new tissue. As soon as an injury occurs, the primary damage response is activated. The body then sends a message to the brain telling it that the body has injured itself. This then triggers the area that has been injured to be painful and swell. The way you can tell if an area is damaged, the damaged area is inflamed, is redness due to an increase in blood flow, become tender to touch, reduced range of motion and functioning, and an accumulation of fluid around the damaged area. These responses are activated to stop us from carrying on as normal and injuring ourselves even more. If the area is painful and doesn't work properly, then hopefully the person won't keep on using it. Hematomas are caused by an injury to the wall of the blood vessel, which leads to blood seeping out of the blood vessel into the surrounding tissue. A hematoma can result from an injury to any type of blood vessel, artery, vein, or small capillary. Hematomas are large swellings of blood which the body usually reabsorbs, but sometimes they need to be surgically drained. There are two types of hematoma, which are intramuscular and intermuscular. Intermuscular hematoma is when the bleeding occurs between the muscle and when the muscle wall and blood vessel are damaged. Bruising and swelling occurs between 24 and 48 hours after the injury. The swelling is temporary, and as long as you use rice, the recovery will be quick. An intramuscular hematoma is bleeding within a muscle. Pressure builds up which prevents further bleeding. It is more serious than an intermuscular hematoma because the swelling persists because fluid is drawn from the surrounding tissue. When we cut ourselves, our body has some mechanisms which prevent us from losing blood and to stop the cut from getting infected. Immediately after we cut ourselves, platelets in the blood are activated by chemicals. The platelets then make the blood sticky. This causes the blood to clot and stick to the blood vessels. There is now a clot that has been formed. The clot then becomes a scab which protects the new delicate skin that forms underneath. When the new skin is ready, the scab falls off. After an injury, our body starts the healing process. Stage 1. The body immediately inflames the damaged area in order to protect it and to stop us using it and causing more damage. Stage 2. Once the area has been inflamed, the body can begin the repairing stage. This usually occurs within the first few hours of the injury and can last up to 6 weeks. This stage focuses on rebuilding damaged tissue. Remodeling is the final stage. If the things are done right for the injury, then new tissue will be created, and long-term scarring will diminish, and strength and range of movement will improve. There are 3 different levels of severity for an ankle injury. The first level is first-degree ankle sprain. This includes a little tearing, pain and/or swelling, but joint stability is good. A second-degree ankle sprain is more severe. This includes the broadest range of damage, moderate instability, and moderate to severe pain and swelling. Finally, a third-degree sprain is the most severe type of sprain. This is when the ligament is completely ruptured, the joint is very unstable, and there is severe pain and/or swelling, and the other tissues are damaged. For all the other injuries, you would apply rice, but for the second-degree sprains, you would take the injured person to the minor injuries unit, and for the third degree, you would call an ambulance. As soon as an injury happens, the first thing that comes to mind is fear, our body's immediate natural response to injury. For instance, if Chris Froome is descending down a hill and he comes off his bike, then immediately he will experience fear. Just after the injury has happened, Chris will be feeling stressed and anxious. He will be stressed because he will think about whether he can carry on, with the race, and he'll be thinking about his cycling career and whether he'll race again. He might feel angry with himself because he could have misjudged how fast to approach a corner. In hindsight, he might look back and think that he made a stupid decision. He might feel angry with another cyclist if they caused him to fall off. When he is in hospital or recovering from the injury, he might feel frustrated that he can't cycle because he knows that the more time he takes out, the more difficult it will be to come back. He might miss cycling, and this could also make him feel frustrated. He might feel less confident when he approaches corners in the future. In a race, he might remember when he came off before, and he might go very slowly and lose time and speed in an important race. When an athlete gets injured, they have to take part in a rehabilitation program to help them recover. Different athletes experience different psychological thoughts when they are trying to get better. Most athletes, when recovering from an injury, need motivation to help them to get better. When Chris Froome is recovering from his injury, he might use goal setting to help him to stay motivated. He needs to do special exercises every day to give him the best chance of getting better. If he has a goal he thinks he can achieve, then he will do the exercises every day and give himself the best chance of recovering. Giving himself a target will definitely help him to achieve his goals and get a better result. However, his motivation will most likely fluctuate, and at times he will probably feel frustrated and anxious about whether he will be able to cycle again. These emotions will hinder his recovery if he thinks about them too much. Paul Gascoigne suffered a crucial ligament injury to his knee in a dangerous tackle he made on Gary Charles in the 1991 FA Cup final between Tottenham Hotspur and Nottingham Forest. The match had only just begun, but he had already made a chest-high tackle on Gary Parker. Gascoigne would be out of football for months, and he has never psychologically recovered from the injury he has caused himself. He never managed to get back to how good he was before the injury happened. After Gascoigne made the tackle, he got up and stood in the wall for a free kick, but then he collapsed in agony. Gascoigne had suffered a crucial ligament knee injury because he had collided heavily with his opponent. The crucial ligament lies deep within the knee joint, connecting the thigh bone with the shin bone, and it plays a major role in maintaining knee joint stability. The function of the ACL is to prevent excessive forward movement from the shin in relation to the thigh, and also to prevent excessive rotation at the knee joint. Gascoigne tried to carry on playing, but as soon as his knee was put under strain without the ACL, there was nothing to hold the knee joint together, so he collapsed. After a couple of hours, the knee joint would have become painfully swollen due to bleeding within the joint, which is a protective function because it stops the injured person from using their knee. The body tries to heal itself by forming a blood clot that would act as a way of joining the broken ligament together, but the synovial fluid in the knee washes the blood away, so the body can't heal itself. Gascoigne would need to have surgery. Gascoigne had a number of psychological reactions to the injury. Immediately after the accident happened, Gascoigne was in denial that he had hurt himself, because he got up and carried on playing. His next psychological reaction was fear, because he realised that he had done something serious. He then started to feel stressed and anxious because he knew he would be missing out on playing in the FA Cup final. When he was in hospital, he felt a mixture of anger and depression and frustration because what had happened had sunk in, and he regretted making the challenge. A week before that cup final, I did coaching videos for kids showing them how to tackle properly, otherwise they'd do their knee in, he said. But that's exactly what I did. I didn't tackle properly, and I did my knee in. He felt completely isolated from his teammates because they walked up the steps to get the cup and he didn't. The minute I started crying was the minute they were walking up the steps. He said, that was my dream. I still get a lump in my throat when I talk about it. I wasn't bothered about lifting the trophy. I just wanted to walk up those steps. The long-term psychological effect on Gascoigne is regret. Paula Radcliffe is the current women's world record holder for the marathon with a time of 2 hours, 15 minutes and 25 seconds. She won the London Marathon 3 times and the New York Marathon 3 times. She represented GB at the Olympics 4 times, but she never won a medal. At the Athens Olympics in 2004, she was the favourite for the gold medal, but a hematoma injury ruined her chances and she dropped out of the race. The hematoma was underneath her vastus medialis muscle above her left knee. You don't use it to run, but it acts as a stabilizing muscle on uneven ground and hills. 2 weeks before the Olympics, Paula was out running when a fast car drove by and kicked up a stone, which hit Paula's knee and caused the hematoma. The force of the stone caused the hematoma. Fluid then built up around the hematoma. Her body was trying to make her stop running and rest. So that she could run in the Olympics, doctors syringed the blood from the clot, injected it with cortisone, and gave her strong anti-inflammatories. This meant that she could run, but the anti-inflammatories interfered with Paula's digestive system, which meant that she couldn't absorb food. During the race, she had no energy, and she had to stop to go to the toilet. She couldn't run, and she had to abandon the race. When the injury happened, she was adamant that she would race in spite of it. She was in denial that the hematoma would stop her from running the marathon. She felt determined to make sure that she would run the race. Um, when she had to abandon it, she was in despair, and you can see this from the photograph. She tried to do the 10,000 meters 5 days later at the Olympic final, but she had to drop out again. The media gave her a really hard time about dropping out of the race, and Paula felt upset and angry. After Athens, she was not supposed to be running, but she carried on running anyway. She was determined, and a year later, she won the World Championships. Paula Radcliffe's psychological response to this injury and other injuries in her career was to give it everything she had and to do her best. In spite of all the injuries that Paula Radcliffe faced, she never gave up and she was psychologically strong. "I never got it right in 3 attempts, but that's the nature of the sport," she said. She was very stressed and she couldn't sleep.